Let me check, then we'll start. Am I audible and visible? Am I audible and visible? Let me know. Am I audible and visible? Let me know. Okay, fine. Fine. Hello everyone. Welcome to Unacademy Future Doctors. I myself Dr. Dipti and I am your faculty for Physiology. Let me explain in brief about our subscription. We have two kinds of subscription, as you all know. One that is plus subscription and second that is iconic subscription. Features of the plus subscription: here you can choose the best from the best. You can access live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access QBank, which is having more than 25,000 questions, compete in the live test. And with 12 months and above subscription, you can get printed notes too. In iconic subscription, your access to the best from two of the best, and the two are: one is Unacademy Prep Ladder with Unacademy, all the features I have explained, and second that is Unacademy and Prep Ladder with Prep Ladder. Here you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and more, rapid revision and snapshots and treasures in 2021 Dream Notes. Also, we have added certain features in our special class. We made the class interactive and live. We have the facility of raise a hand. You can talk to your educators in live class. You can poll for the learner. You can never miss a class as you are always notified for your class. You can download PDF notes for your lectures and you can attend your class anywhere and at any time. Also, we have updated and highly effective question bank, which is having more than 25,000 high yield clinical questions based on the latest exam pattern with detailed explanation too. These are our NEET PG 2021 toppers. Also, we have started our Focus FMG 2022 comprehensive batch from 15 December 2021, that is for 6 months, and Target NEET PG 2022 test and discussion batch from 15 December, that is for 3 months. And we also have educated curated tests. Different tests are planned in the month of January, and we also have scholarship for all this for second and third rankers. You can subscribe from your mobile, either plus or iconic subscription, and if you use my code DIPTI10, you will get 10% extra discount on each and every subscription. Also, we have started another feature, that is live test. You can also join the test. I'll just show you a video how you can join the test. You can see here, take a quick quiz. You just click on that, so you can go to live quiz. Just you can open the app and click on the take a quick quiz and you can enter the code. I have generated the code. You can write down the code also, 491764. Okay, so when you enter this code, you can join. At least you require 2 members to join the quiz. Okay, so this is the way how you can directly join the quiz. Okay, now we start with our today's topic. In my today's topic, learning objective, that is functional anatomy of cardiac muscle. Okay, so as we have completed skeletal muscle as well as smooth muscle, now today we'll discuss about cardiac muscle, one of the very important muscle in our body, and in continuation we will discuss cardiovascular system also. So we are completing our muscle physiology today in today's class. So first we discuss about cardiac muscle, functional anatomy. We will discuss about difference between skeletal muscle, smooth muscle and cardiac muscle. And from tomorrow onwards, we will discuss about properties of cardiac muscle that is included in cardiovascular system too. Okay, so today we'll discuss about physiology, or you can say functional anatomy of cardiac muscle. How cardiac muscles they look, what is the structure, and what are the structural characteristics of cardiac muscle. Okay, so now heart is composed of just a minute. Sorry, just a minute. Just a minute. I might have opened this one maybe. Just give me 1 minute. So here, I think some of the diagrams are missing in this slide, so I have just started this one. Okay, fine. So here, heart is composed of mainly 3 types of cardiac muscles. You can see, you all know that heart has got 2 atria and 2 ventricles in human heart. So we have atrial muscles in the atria, atrial muscles, ventricular muscles, the ventricular muscles, and we have specialized excitable, or you can say excitatory and conducting muscle fibers. Okay, so excitatory and conductive muscle fibers. We have atrial, these two are atria. Ventricle, one ventricle is on the posterior surface, so atrial muscles, ventricular muscles, and specialized excitatory and conductive muscles. Okay, now cardiac muscle. In which group cardiac muscles are there? So we have discussed skeletal muscles are voluntary striated, smooth muscles are involuntary non-striated, and here cardiac muscles, they have one character from smooth muscle and another character from skeletal muscle. Okay, so skeletal muscle striated, cardiac muscles are striated, so they have taken one character from the skeletal muscle, they are striated, and one character from the smooth muscle, they are involuntary. Okay, heart contraction is not under our control. If I tell you that you just increase your heart rate or decrease, you cannot. So these muscles are involuntary and striated muscle. Okay, now so these muscles, they contract mostly same way as skeletal muscle, but some differences are there. Duration of contraction, other differences, they never get titanized, no tetany, no fatigue. So these are the important characteristics. Now size of the cardiac muscle, length of the cardiac muscle is about 100 micrometer. Okay, and breadth, that is about 15 micrometer. Okay, then other terminologies are same as skeletal muscle. Sarcolemma, skeletal muscle as well as cardiac muscle, cell membrane of the muscle cell. Okay, sarcoplasm, that is cytoplasm of the muscle cell. Okay, fine. Then comes myofibrils. Now this, as we have discussed in skeletal muscle cell has got myofibrils. This also have myofibrils. Okay, myofibril consists of myofilaments, actin and myosin filaments. Okay, and this myofibrils, they are smaller. Their diameter is about 1 to 2 micrometer, and they are arranged in such a way that they give striated appearance. You can see here in this diagram. These are, you can see here, actin and myosin filament. You can see here this are, and because of that, striated appearance of cardiac muscle is here. Okay, now next is, as we discussed, other is specialized conducting system. So cardiac muscle also has excitatory and conductive fibers. Okay, so their function is to conduct the impulse, generate and conduct the impulse. Heart has its own pacemaker. Pacemaker means it generates its own rhythm. If heart is kept outside our body without any nerve supply or anything, still heart muscle can contract by its own and generate its own rhythm. Now, how the rhythm is generated? It is generated by SA node, sinoatrial node. Okay, then it is conducted from SA node to AB node. I think you must have learned this in lower standards. Okay, we will discuss all these things in detail in our physiology. Okay, then SA node, then AB node, then comes bundle. Okay, AB node bundle or bundle of His. Then bundle branches, you can see here, right and left, and Purkinje fibers. Okay, so this is specialized conducting system. Now they have capacity of generation of impulse and transmission of impulse. Okay, so this is excitatory system, and that is important for rhythmic beating of the heart. Okay, heart rhythm is regulated by rhythm of our SA node, and this property is known as, we will discuss with properties, autorhythmicity. Automatically heart generates its own rhythm, so this is autorhythmicity. Okay, so this is the important property. Conductivity is also the property of cardiac muscle. Conductivity, conduction of impulse. Okay, excitability is also property of heart muscle. This is all you learned in lower standard. We will discuss. This is just interesting things. So excitability, conductivity, autorhythmicity, all these are because of specialized conducting system in the heart. Okay, now next is, now we'll discuss about functional anatomy, physiological or functional anatomy of cardiac muscle. Okay, here you can see they are ribbon like, okay, like the ribbons, and they are arranged in lattice work with fibers. These fibers, they are dividing and they are joining with each other. So you can see here, somewhere they are joining, somewhere from one fiber, you can see like this. Suppose here this way, then they may join also. So these are, they form lattice, they are arranged in lattice work structure. Okay, now so this cardiac muscle fiber as I told you is muscle cell. Cardiac muscle fibers or muscle cell. Okay, so these are branched, they have branches, you can see here. These are branched, interdigitate freely with each other, means they are connected with each other, as well as I told you that they join as well as they get separated. Okay, so they join with neighboring fibers. Okay, now another, here two terminologies are very important. You can see here, one is intercalated disc and second is gap junctions. Okay, students, they get confused between these two terminologies. We will discuss in detail. So now what is this intercalated disc? Here also in this diagram it is shown. So intercalated disc, these are the tight junction between two muscle fibers, cardiac muscle fibers. Okay, so here when one cardiac muscle comes in contact with the second, cell membrane of this cardiac muscles, both the cardiac muscles, this cell membranes, they are fused together. Okay, and they give folds. You can see here foldings are there. This membranes get fused together and extensive folds are there, and this is your intercalated disc. I repeat, at the point of contact of two muscle fiber, cell membrane of the muscle fiber fused together and it throws extensive, you can see extensive folds, and it forms intercalated disc. Okay, so these are also known as, another name for intercalated disc is low resistance bridges. Okay, low resistance bridges. Okay, so they will not allow passage of ions or action potential or anything. Okay, but along with that, you can see here, these are your intercalated disc. You can see here, these are, and this is the cross section. You can see these are intercalated disc like this. Cell membrane extensively folds and they form intercalated disc. Now, but along the side near, you can see outer border here of this intercalated disc, we have gap junctions. What is this gap junctions? These are the junctions through which cardiac muscle fiber or one cell is attached with the neighboring cells. Okay, so here very important thing, gap junctions are for connections and intercalated discs are for separation. So here you can see there is syncytium. Syncytium means single unit. So cardiac muscles, they act as single unit or syncytium. Okay, now very important thing here, this gap junctions, they are not anatomical connections, but they are physiological connection. Not anatomical but physiological connection between two cardiac muscle cells. Okay, and through these gap junctions you can see when action potential is there, it passes from one cardiac muscle cell to other one. Okay, so this is the importance of, and because of this, because of gap junctions, this cardiac muscle cells, they act as syncytium, single unit. Very important thing here. Now another important thing here, you can see in this diagram, again you can see here, these are your intercalated discs. You can easily, these things are very confusing, you won't find anywhere. Okay, so what is this intercalated disc? I just repeat, at the point where one cardiac muscle is in contact with the other cardiac muscle, you can see here. Okay, both this muscle fiber membrane gets fused together and they throw extensive folding. You can see these are the foldings and they form intercalated disc. Okay, this diagram is easily you can see here. And what is gap junction? Along the sides near outer bridge of the intercalated disc, you can see here there are gap junctions. Okay, so through gap junctions, action potential and ions, they can pass from one cell to other. And these are anchored. Anchoring means strengthening by the intermediate filaments here. Okay, so you can see here. Now, so this is the thing we have discussed now. So we have, you can see two syncytium in heart. One is atrial, because atrial muscles, they have gap junction. So atrial syncytium, and second is ventricular syncytium. So suppose you are stimulating one part of atrium, directly it will stimulate the whole atrium. One part of ventricle, the whole ventricle is stimulated. But suppose impulses, if we wish to transmit the impulse from atria to ventricle, how? That requires our conducting system. Okay, conducting system, that is SA node, as we have discussed, to AV node, then AV node to bundle, bundle to bundle branches. Okay, and from bundle branches to Purkinje fibers and all. Okay, now next very important structure in the cardiac muscle, that is Sarco-tubular system. One more announcement before that. One is we will be having a special class on Sunday only, this Sunday 30th January at 2 p.m. So please enroll for the class. In this special class we will discuss about all the question answers, important question answers from muscle physiology, those they were asked in your university exams. Okay, so please attend this special class. This is very important. I will share the link in tomorrow's class. Okay, so in description box I will share the link of my special class, but I request you all to attend the special class to get your doubts clear. Whatever we learn in the muscle physiology, all things, all question answers I will discuss in special class. Okay, now we'll discuss sarcotubular system. Cardiac muscle also has well-developed sarcotubular system. Okay, it is not well developed in your smooth muscle. Smooth muscle में well developed नहीं होता. In both skeletal muscle and cardiac muscle, दोनों में best well developed this sarcotubular system. Very important thing is, hello Mayur, hello Zubida, thanks for the response. Okay. Now, another announcement for you all, that now you be regular, because now next system we are starting cardiovascular system, very important for your physiology as well as your medicine. We will discuss ECG and blood pressure and pulse and so many important topics in our next coming month. So please be regular. How action potential is generated here by assay node. We will discuss that. Assay node has, I'll just show you. Assay node, Zubida, assay node has the property of autorhythmicity, means it generates its own rhythm. Very important, another thing, your question is very good. All these tissues, assay node, AV node, bundle of phase, Purkinje, they all generate their impulse. But rate of impulse generation is highest in the assay node. Rate of impulse generation of assay node is 70 to 80 per minute. Okay. AV node impulse generation rate is less, 40 to 60 per minute. Okay. Bundle has little less, 20 to 40. So highest is this. And for this reason, our whole heart contracts at a rate of assay node always. So assay node is known as pacemaker of our heart. Okay, suppose if I put heart of anybody outside the body with nutrient supply, oxygen supply, then heart will beat by its own. It doesn't require any nerve supply, any blood supply. Skeletal muscle, they don't have this property. Skeletal muscles, they require nerve supply for the contraction. Okay, heart contractions are affected by nerves. Like suppose if we stimulate sympathetic, heart rate increases. Why Purkinje fiber has low action potential? No, beta, it is not action potential. It is autorhythmicity. Both are different things. We will discuss in detail. This is the rate of impulse generation. Action potential is different thing, and this impulse generation is different thing. And this is inherent property. Inherent property means it is by birth, that is decided. This rate generation of assay node is this much, AV node is this much. Am I clear? We will discuss. We have a separate topic, Zubida. We will be having separate topic for autorhythmicity. Okay, am I clear? Am I clear, Zubida? It is not action potential, beta. Action potential is different thing and rate generation is different thing. Okay, this is inherent property. Inherent means decided. This is, you can see anatomy में बोलते हैं ना कि ये है तो ये है. Okay, जैसे डिसाइड किया है कि ऐसे नोड इतने रेट पे जनरेट कर रहा है Purkinje fiber, because function of Purkinje fiber is to conduct, not to generate. Okay, Purkinje fiber का conduction rate is 5 times more than ऐसे नोड. ओके, जो जिसका जो काम है वो ज्यादा करेगा ना. एम आई क्लियर, जुबिदा? तो कंडक्शन इज 5 times more than ऐसे नोड, more than other tissues. So it is his job. Am I clear? Okay, now we'll continue. Now another important thing here, sarcotubular system. What is the difference between skeletal muscle and cardiac muscle sarcotubular system? Here, suppose if you remember, in skeletal muscle we have discussed, you can see this is sarcomere. Okay, try to remember this difference, very important one. This is this one. Okay, this is your A band, I band. So here you can see this is myosin filament and actin filament. So I will just show you with other pen so it becomes easy for you to remember. So here this sarcotubular system is here. T tubules, one is here and one is here. So in very important thing here, in skeletal muscle, sarcotubular system is present at AI junction. Okay, whereas in cardiac muscle, this is present. Now I will draw cardiac muscle sarcotubular system with different color. Here it is present at Z line, here only. this T tubule. Okay, so you can see in skeletal muscle, one sarcomere has 2 T tubules. Whereas in cardiac muscle, one sarcomere has 1 T tubule. Am I clear to all? Okay, so this is also structural difference. Okay, and we have discussed triad. What is this triad we discussed? Triad here. Triad means, can anyone answer? This you can see. This is your T tubule and sarcoplasmic reticulum on both the side, terminal cistern. It forms triad. Okay, so in here also you will be having triad, this one. So in skeletal muscle we have 2 triads per sarcomere. Am I clear? And in cardiac muscle 1 triad per sarcomere. And this is the reason skeletal muscle contractions are more powerful, because 2 tubules, so double action potential enters here rather than cardiac muscle. Am I clear? Am I clear to all? Let me know. Okay, fine. Now, next very important character of the T tubule here. T tubules in your cardiac muscle, they are wider than skeletal muscle. Okay, good, Mayur. So they are wider. Their width is, you can see, diameter of T tubule in cardiac muscle, that is 5 times more than skeletal muscle. That is one difference. Second thing is, and volume is 25 times more than skeletal muscle. Okay, they have terminal cistern, triad is also there. Sometimes dyad is there. Not both the sides you will be having this terminal cistern. Okay, so this is the structure. Very important other thing we are coming is in cardiac muscle, the sarcoplasmic reticulum is not well developed like skeletal muscle. Okay, so what happens? Why, if sarcoplasmic reticulum is not well developed, what happens? Calcium ions are less. Okay, so here what happens? Calcium ions in the cardiac muscle, if we are talking, this is skeletal muscle. So if we are talking about cardiac muscle, this calcium ions, they come from extracellular fluid. Why? Because sarcoplasmic reticulum is not very well developed. Am I clear? So you can see this is one more difference. Another important thing here is T tubules of your cardiac muscles, they have mucopolysaccharides inside them. Suppose this is your T tubules. Okay, so inside you have mucopolysaccharides, and these mucopolysaccharides are negatively charged. So what they do is they attract calcium ions. So whatever calcium ions from extracellular fluid, they get attracted. They are there stored inside also. So they have large amount of abundant storage of calcium ions. So whenever action potential comes, this calcium ions, they enter in the sarcoplasm. So this is your, suppose this is your cardiac muscle. So this way. So this calcium ions from extracellular fluid are available. Okay, so and this is experimentally proven. How? If suppose we reduce this calcium ions delivery from outside, then cardiac muscle contraction, they become feeble. Certain drugs are given. Name of the drug, that is calcium channel blocker. Okay, they block the calcium channel, so outside calcium ions, they cannot enter. And what happens when calcium ions, they cannot enter? Then there is decreased force of contraction of cardiac muscle. So this is very important structural characteristic of cardiac muscle. Next is, after excitation, muscle contracts. The same thing here. You can see when action potential comes, you can see here in this diagram. Here, then action potential comes, it enters through T tubules, calcium ions are available. Now this calcium ions, they bind with troponin C and troponin tropomyosin. You can see here, and there is sliding here, like it is like same way in cardiac muscle also. Okay, Zubida, ma'am, T tubules are present everywhere or present in only cardiac muscle? T tubules are present in cardiac and skeletal muscles only. Okay, not in the smooth muscle, cardiac muscle and skeletal muscle. Okay, fine. Now, next is this electrical activity we are recording in the heart is known as electrocardiogram. And this electrical activity is followed by muscle contraction. That is mechanical activity, and this is known as your cardiac cycle. Cyclic changes in the heart during each heartbeat. Okay, so cardiac cycle. This also we will discuss. All these important topics we are going to discuss in our next month. So please don't miss any of the class. Okay, now, so this here we have completed some important characteristics of cardiac muscle. Now, very important thing we are coming is difference between all this skeletal muscle, cardiac muscle and smooth muscle. Let us compare all of them. So we have some important points to compare. So starting with first, location. The name itself suggests skeletal muscles, they are attached with bones, skeleton. Cardiac muscles present in the heart. Smooth muscles present in the viscera, like viscera of digestive tract, GIT, uterus or reproductive tract, urinary bladder, etc. Shape, we all know cylinder like. There is no branches like cylinder like this skeletal muscle. These are cylindrical cardiac muscle, but branches are there, as we have discussed. Gap junction and intercalated disc are there. We discussed just now in this class like this. So branching is there. Whereas smooth muscle, the shape is spindle shape. We have seen just this is the revision. This is the shape of smooth muscle cell and no branching is there. So branching is only in your cardiac muscle. Okay. Length. From all these three, this is macroscopic. Means without microscope, you can see the cell. So length is 1 to 4 centimeters skeletal muscle, 80 to 100 micrometer cardiac muscle, 50 to 200 micrometers smooth muscle. Diameter, skeletal muscle, try to remember 10 to 100 micron, cardiac muscle 15 to 20 and smooth 2 to 5 micron. Nucleus, very important thing, all of them have one. Only skeletal muscle has one or more nucleus. Okay. Striations, both skeletal and cardiac muscles are striated, smooth muscles are non-striated. Okay. Then comes myofibrils. Myofibrils are present in, I'll just show you. Myofibrils are present in both skeletal and cardiac muscle but absent in smooth muscle. Sarcomere present in these two, skeletal, and this is skeletal muscle, these are cardiac, and this is smooth muscle. Okay. So sarcomere is also absent, not well defined sarcomere here. No Z-line, dense bodies are there in smooth muscles, we have discussed like this. And to the dense bodies, we have this actin filaments like this, if you remember. Okay. Otherwise, if you cannot remember, go to my smooth muscle class, I have explained this thing. Okay. Then comes troponine, very important structural difference is troponine is absent in smooth muscle. Okay. Sarcotubular system, that is well developed, as I told you, T tubules are there as Zubida asked. Okay, that is well developed in skeletal cardiac muscle, poorly developed in smooth muscles. Okay, then next is T tubules, also we have discussed, long and thin in the skeletal muscle, short and broad in cardiac muscle and not present in smooth muscle. Okay, source of calcium, sarcoplasmic reticulum, here both sarcoplasmic reticulum plus extracellular fluid, and here there is no sarcoplasmic reticulum, so only extracellular fluid. Okay. Depolarization, very important thing here. As I told you, skeletal muscle, this is skeletal muscle again, this is cardiac muscle, this is smooth muscle. Okay. So skeletal muscle always require nerve stimulation, as I told you. So stimulation. Cardiac muscle, nerve stimulation can change, but without nerve stimulation also spontaneous contractions are present. Another important characteristic is fatigue. possible in skeletal muscle, not possible in cardiac and smooth muscle. Summation, if we are giving two stimuli, summation is possible in skeletal muscle, not possible in cardiac muscle. And this is the reason cardiac and skeletal smooth muscles are not fatigued. Okay, so if there is summation, there is tetanus and fatigue. But here no summation, so no tetanus and no fatigue. Okay, smooth muscle may get tetanized sometimes because continuous contraction is there here, but cardiac muscle never gets tetanized. Okay? Resting membrane potential. What is resting membrane potential? It is the potential difference across the membrane in resting state. In resting state. Here this is stable, and in cardiac muscle also stable, but smooth muscle the potential is not stable. In cardiac muscle also SA node has not stable, and this is the reason SA node is pacemaker. I will discuss tomorrow why they are pacemaker and why this is not stable. Then contractile proteins. Contracting protein is troponine here in this too. Why? Because calcium ions binds with troponin C. And then contraction starts. But here calcium ions they bind with calmodulin. Calcium calmodulin complexes are formed. Okay. Speed of contraction is fast in the skeletal muscle, intermediate in the cardiac muscle, and slow in the smooth muscle. Okay. Neuromuscular junction well defined in the skeletal muscle, not in this too. Action, as we have discussed, skeletal muscles voluntary because the nerves are here, you can see somatic nerves, whereas cardiac muscles and smooth muscles are involuntary. As I told you, if I tell you to increase your heart rate, you can increase? No. So these are involuntary. If you have pain in the stomach, if I tell you just stop stomach contraction, can you? No. So these are involuntary. And involuntary muscles are always supplied by autonomic nerves. Autonomic nerves, we have discussed two divisions, parasympathetic and sympathetic. Parasympathetic and sympathetic nerves. Sympathetic. Okay. Parasympathetic nerves, they have opposite actions than sympathetic. So both are in opposite direction. Okay. Now control. Here it is always dependent on nerves. Totally nerve, they control the skeletal muscle. Whereas here muscle itself controls the contraction. But smooth muscle both nerve as well as neurogenic as well as myogenic. Okay. Starling's law is applicable in skeletal and cardiac muscle, as I told you. Whereas not applicable in smooth muscle, because smooth muscles, they have the property of plasticity. So you go through that smooth muscle, plasticity. You just go to this smooth muscle chapter and learn what is plasticity. Okay. Starling's law, Zubida, we have discussed. I think you are a new student. I will explain again. Starling's law suggests that whatever initial length of within Starling's law, I will just tell you. Starling's law is within physiological limits. Within physiological limits, force of contraction is directly proportionate to initial length of muscle fiber. What is, I will explain. Muscle fiber. Okay. Suppose if you have seen rubber band, suppose you are stretching your rubber band. Okay, like this. So more you stretch, more will be the contraction. Okay, but this is within physiological limit. बहुत ज़्यादा stretch करेंगे तो टूट जाएगा. So this is the characteristic of skeletal muscle and cardiac muscle. If you stretch the muscle, more the stretch, more will be the contraction, because actin and myosin filaments are stretched. Am I clear? Same in cardiac muscle also. Suppose your cardiac muscle is getting more venous return. More blood is coming through veins. More venous return, more stretching, more initial length, more the force of contraction. Am I clear? So this is your Frank-Starling's law. Am I clear? Okay, am I clear, Zubeda? Okay, so this is Frank-Starling's law applicable to this too, not to the smooth muscle. Okay, so this is all about your all the three muscles. These are some questions. Because of lack of time, I am not discussing answers. We will discuss in our special class answers of all this. Okay, so just write down questions if you wish to write down questions from today's class. What are the characteristic features of cardiac muscle? That is one question. We have discussed intercalated discs, gap junctions, then involuntary striated. Okay, then specialized excitatory and conductive fibers we have discussed, SA node, AV node. Okay, all characteristics of cardiac muscle fibers. Then this is muscle fiber I am talking about. This is cardiac muscle difference. Muscle fiber is single cell. So here what you have to write down about the cellular structure. Here about the whole muscle. Okay. Zubida. Okay. It is written Zubia beta. Okay. Zubia. Sorry. Okay. Tomorrow class, Mayur, I have daily 10 p.m. classes. Classes at 10 p.m. daily. Only not on Sunday. Saturday, Sunday नहीं होते. कल Saturday भी रखा है. Okay. Otherwise, daily at 10 p.m. I have my class. Okay. And Sunday, don't forget, I have my special class at 2 p.m. स्पेशल क्लास के लिए ऐप के ऊपर आप जाके स्पेशल क्लास पे क्लिक करो एंड जस्ट कम टू माय स्पेशल क्लास. दैट इज very much interactive. Those students are joining me in the special class. They just are very much interactive classes. Okay, so please join that also. Okay, Sunday at 2 p.m. special class is there. Okay, in special class we will discuss all the question answers, whatever topics we have discussed in muscle physiology. So that is your revision of muscle physiology like. Okay, now next is gap junctions we have discussed. Okay, and importance, that is to make the cardiac muscle a syncytium. Okay, syncytium. Next question, how many triads are present? We have discussed one triad. One triad per sarcomere. Why? Because the triad is present at Z line here. In skeletal muscle, it is present at, we have discussed this one, AI junction here. So two triads are there here. Here only one triad. Difference between sarcotubular system we have discussed. T tubules are wider, having mucopolysaccharides, having calcium ions and all. Characteristic features of T tubules we have discussed. Release of calcium ion also we have discussed. So this is all about today's class of cardiac muscle. Okay, thank you. Thanks for being with me. If you like my class, you can like it, you can share with all your friends, and you can subscribe our channel, that is, and hit the bell icon. Our channel name is Unacademy Future Doctors. Unacademy Future Doctors. Okay, so please subscribe the channel so you get all the notifications